The next part of the mommy makeover that we'll talk about is the abdomen. That's where a lot of the action occurs, because the abdomen has to change significantly with pregnancy. When I evaluate a patient's abdomen, I look at three things. I look at the skin, I look at the fat, and I look at the muscle. Usually the skin is loose. Usually there's extra fat, especially below the belly button. And often the muscles are separated. If all those three things are going on, a patient needs a tummy tuck. If there's only extra fat, liposuction can work. If it's just skin, sometimes we just remove a pinch of skin, or a patient may be a good candidate for thermage, which is a non-surgical tightening procedure. Most women, though, if they've had more than one child, large children, or multiple births, wind up needing a tummy tuck. And I'll talk about the reasons in just a second. So what exactly happens in a tummy tuck? Well, one of the main things that happens when women have a child is that the rectus muscles, which are the six-pack muscles that are in the middle of the abdomen, are generally together. And they're together like this. When you have a baby, in order to make room, the abdomen stretches out and expands and the muscles go apart. Then they come back. Next baby, they go apart and then they come back. At some point, for many people, they don't come back. They leave a separation in between, which is called a diastasis. It's almost like a hernia. This separation can actually be felt when you're doing a crunch. You can actually get your fingers in between there, and that's how I examine a patient to tell. And the other thing that happens is that when this is going on, it's impossible to have a flat abdomen because that muscle isn't together, so it causes an almost pregnant type look because it cannot be tightened. And the worst thing is, the more crunches and the more ab work you do, when you have this, the worse it gets. So how do we do a tummy tuck? There's an incision made, a smiley incision, down at the hip level. The skin is then lifted up all the way to the breasts, like the hood of a car, so we can actually see what we're working on. Once we've done that, the muscle repair is done by suturing the muscles together, back and forth, kind of like a corset, so it pulls everything in really tight. And that is a permanent, natural internal corset. There's no cutting, it's only suturing. Once that's done, the extra skin is pulled down like a window shade, and in general, the skin that is removed is the skin between the belly button and the bikini line. So the skin at the top of the belly button is actually pulled down to the bikini line. Once this is pulled down, the belly button has been left down on the muscle area. It was separated at the beginning of the procedure. When this is pulled down and then this extra is removed, there's a little hole made right here, and the belly button is put through a new spot. Same belly button, new position in the nice flat tummy. So a tummy tuck corrects the skin excess, it corrects the fat excess down here, and it also corrects the the muscle problem that's associated with pregnancy. Okay, so let's go on. Now we'll talk about the last part that can be involved in a mommy makeover, and that's the body. By the body, I mean everything else that's not abdomen or breasts. Things like your back, your hips, your legs. Weight can be gained in all of those areas with pregnancy. As a matter of fact, they've done studies that show that the weight gain in women's thighs, primarily outer thighs, is where a lot of the energy source for breastfeeding comes. And quite often that goes down somewhat with breastfeeding. The problem is, once the whole child rearing breastfeeding process occurs, the body becomes primed to do it and is ready for it, which means that it's very difficult to get rid of fat in those areas, and it becomes diet-resistant fat, and that means that it becomes a candidate for doing liposuction. So the areas where we consider liposuction are in the back. Women tend to accumulate excess in their hips or their flanks, also in the back, below the bra line area, and in the buttocks, and outer and inner thighs. All of these areas can be suctioned to remove the excess fat in those areas and recreate the waist, recreate or enhance the normal contour. These are the areas where my patients experience the most frustration, because you can go to the gym all the time, you can live on chicken breasts and lettuce, you can lose a lot of weight, you can become very fit, but in a lot of cases these areas will not go away, and the only solution is to do liposuction on those areas. So, in summary, a mommy makeover is a combination of procedures that is individualized to every single patient. Usually it involves some sort of breast surgery to bring the breast back to the pre-baby body, or maybe even a little better. There's usually some sort of abdominal surgery, usually an abdominoplasty or a tummy tuck, that is also designed to bring the abdomen back to the pre-baby body position. And there may or may not be involved liposuction in these other areas. Usually a mommy makeover is a one-stage operation, but sometimes if there's a lot of changes that have happened in a lot of areas, there may be one main operation like breast and tummy, and then some additional liposuction. It depends on the individual person. So every mommy who has these changes would benefit from a makeover. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.